Okay, we talked about these areas here, adjacent to the foramen magnum. This skull, by the way, only has one posterior convoluted canal. It doesn't have one on the right side. This would be the right side over here and the left side over here. It does have a hypoglossal canal. Coming in underneath the condyle. This is a different height thing. Okay, so this is a hypoglossal canal. Hypoglossal nerve will be coming off of the brainstem, adjacent to this structure we call the olive, or olivary nucleus. Here is a styloid process here out to the side of that, and between the styloid part, you can't see it. Can you see it here? Okay. Here is the stylomastoid foramen. The facial nerve proper exits that foramen. Here is the jugular foramen. Here. And just in front of the jugular foramen is the external opening of the carotid canal, where the internal carotid artery enters the skull. Not the external carotid artery, but the internal carotid artery enters the skull. Now, there's another opening here that you need to know that lies between these two foramen. And as small as it is, it's still a rather significant structure, or a significant opening. This opening lies on a rigid bone that lies between the jugular foramen and the external opening of the carotid canal. Is that true? So let's see if we use the other end. Okay, that's called the inferior tympanic canaliculus. And that is transmitting a branch of the glossopharyngeal nerve that is the autonomic component that's going to eventually innervate the carotid gland. This is going to be its lesser petrosal branch of the, the glossopharyngeal nerve. It's going to innervate the carotid gland. It's going to actually go through this opening, pass adjacent to the middle ear chamber, pass out of a slit in bone adjacent to the facial hiatus, and then go down and synapse in that otic ganglion that's sitting on the medial side of the mandibular division of the trigeminal nerve. So tiny but powerful. As we come forward here, we have an opening. Let's look at it on this side. Here's the carotid, the external carotid opening. Here is an opening. This little spike of bone right here is called the sphenoid spine. This opening that is adjacent to the sphenoid spine is called the foramen spinosum. The middle meningeal artery goes through there. On the medial side of these two openings, there is a foramen here that is called the foramen lacerum. Now, some authors say there's nothing that passes through the foramen lacerum. I don't know how this got started, but obviously it got started a long time ago. That's not true. There is a significant nerve that comes down, passes into the carotid canal. We'll look at the inside aspect of this in a little bit, where this greater petrosal preganglionic parasympathetic branch of the facial nerve joins a nerve called the deep petrosal, which is from the postganglionic distribution from the superior cervical ganglion, the posterior postganglionic sympathetic. So the greater petrosal joins the deep petrosal, and they form a nerve which comes from the inside and goes out, and then turns forward into an opening here that we saw on the sphenoid bone, which is the posterior opening of the pterygoid canal. Okay, so this is, those two nerves come together to form a nerve called the nerve of the pterygoid canal, or the Vidian nerve. So that's on the inferior aspect of the foramen lacerum. So in order to get there, this nerve has to pass through it. Now from below, there's actually an arterial vessel that many times goes in here into the middle cranial fossa to supply some of the dural surface in the middle cranial fossa. And this is called the meningeal branch of the ascending pharyngeal artery. So that actually goes through here as well, but from the opposite direction. We see over here the pterygoid plates. The pterygoid plates are key to this opening because they are forming, at their roof, they are forming the base of this area, this Vidian canal. There are some canals that are tiny that, although they're significant, we don't talk about them much, but these are called these are called pharyngeal canals. These underneath the vomer, here and here, are called vomerovaginal canals, under the vaginal process of the vomer. So these are nerve branches that came from the maxillary sphenopalatine portion into the pharynx. This area in here would be the pharynx. And these nerves are supplying the soft tissues of the pharynx, okay, as branches both from the maxillary nerve, but also from the secretomotor fibers from the facial nerve that are coming from that pterygopalatine ganglion. This posterior aspect here, we're looking into the posterior aspect of the nasal chamber. With this bone here, this is pretty much all vomer that is helping to form the bony nasal septum. You don't really see the perpendicular plate because that's farther inside and farther forward. Alongside the pterygoid plates is a oval-shaped foramen. So what would you call an oval-shaped foramen? Jeez, what a hard structure that is to figure out. So that is where the mandibular division of the trigeminal nerve is entering and exiting the cranial wall. Okay? As we go farther forward here, we see some structures on the maxilla. Externally, we see here, this is the lateral pterygoid plate. This is the tuberosity area of the maxilla. This opening here is referred to as the pterygomaxillary fissure. The pterygomaxillary fissure. Now we can pass this pipe cleaner through the pterygopalatine fossa and through that medial opening or that medial window called the sphenopalatine foramen. So out here would be the intertemporal fossa, in between here would be the pterygopalatine fossa, and in here would be the pharynx. So we've got this long fissure, which is a doorway from the intertemporal fossa into the pterygopalatine fossa, and a window into the pharynx from the pterygopalatine fossa. Okay, where branches of maxillary nerve and the facial nerve postganglionics are going. On the tuberosity aspect of the maxilla, let's see it here because of the teeth are still present. You can see a groove here going into a foramen, and another opening here going into a foramen a little bit larger. This is a groove for the posterior superior alveolar nerve. Posterior superior alveolar nerve, the nerve that innervates the molar dentition in the maxilla. This opening is for the posterior superior alveolar artery. And we'll talk about these again when we talk about the maxillary artery and the intertemporal fossa. So those are in the tuberosity area in the maxilla. If we come around and put the skull down, looking at the palate, the hard palate, we can see some openings in the hard palate as well. This is the palatine bone. Can you see that? Okay, here's a small opening back here. That is a lesser palatine foramen for the transmission of lesser palatine nerves and vessels. And then in front of that, there's a larger foramen called the greater palatine foramen. And those nerves are communicating with the intertemporal fossa region, and the vessels are actually also communicating with the intertemporal fossa region. I'm sorry, the pterygopalatine fossa region. In the front here, we have the incisive canal. I don't think this goes all the way through, but it is actually a bilateral canal. It's on each side of the nasal septum. So that's the incisive canal, or another name for that is the nasopalatine canal. Okay. So what you need to know over the weeks and days of this course is you have to learn all of these foramen, where they are in the skull or on the individual bones, and you need to know everything that goes through them. Okay? And as I said, you may think, well, that's being kind of picayune, Dr. Landers. Well, you're going to be dental practitioners. And if I thought it was picayune, I wouldn't ask you to do it anyway. But by understanding how these nerves run through the skull, how these nerves go through the skull and then innervate soft tissue structures, is how you get the knowledge that you need to basically differentially diagnose the problems that your patients are presenting to you with. And it's not just tooth decay. So you can, we'll be here another hour, and we'll be walking around the room and helping you find some